everyone, I welcome you all to this channel and to this 13th episode of our video, that is Target Nursing Officer exam. And in today's video we will discuss about fever in children and about measles. Question number 1. Normal rectal temperature in children range between option A 36 to 37 degrees Celsius, option B 36.1 to 37.8 degrees Celsius, option C 36.5 to 38 degrees Celsius, option D 35.5 to 38.5 degrees Celsius. The correct option here is option B, which is 36.1 to 37.8 degrees Celsius, or in Fahrenheit it is 97 to 100 degree Fahrenheit. And the temperature in children is higher as compared to the adults. Question number 2. Fever in children is defined as rectal temperature of more than option A 37 degrees Celsius, option B 36 degrees Celsius, option C 38 degrees Celsius, option D 37.5 degrees Celsius. Correct option here option C, which is 38 degrees Celsius or 100.4 degree Fahrenheit. In children, if the rectal temperature is more than 38 degrees Celsius or more than 100.4 degree Fahrenheit, then that children is said to be having fever. And in case of axillary temperature, the temperature is 0.5 to 1 degree Celsius less than or lower than the rectal temperature, or 1 to 2 degree Fahrenheit. In case of Fahrenheit, it's about 1 to 2 degree Fahrenheit lower than the rectal temperature. And a children is said to be having fever if he has a temperature of more than 37.2 degree Celsius or 99 degree Fahrenheit in case of axillary temperature. And in case of oral temperature, oral it's around 0.5 to 1 degree Fahrenheit lower than the rectal temperature, or in Celsius it's 0.25 to 0.5 degrees Celsius lower than the rectal temperature. And the children is said to be having temperature if is said to be having fever if the temperature is more than 37.5 degrees Celsius or 99.5 degree Fahrenheit. Question number 3. Paracetamol dose is dash every 4 hourly. Option A 10 mg per kg, option B 15 mg per kg, option C 12 mg per kg, option D 16 mg per kg. Correct option here is option B, which is 15 mg per kg is the dose of paracetamol given in children every 4 hourly. Question number 4. Ibuprofen dose is dash every 6 hourly. Option A 10 mg per kg, option B 15 mg per kg, option C 12 mg per kg, option D 16 mg per kg. Here the correct option here is option A, that is 10 mg per kg is the dose of ibuprofen and is given every 6 hourly. Since the side effects of ibuprofen is more than paracetamol, so always paracetamol is preferred over ibuprofen, except in few cases where the fever does not subside, so ibuprofen also is given instead of paracetamol. Question number 5. Measles is caused by an RNA virus belonging to the family of option A Flaviviridae, option B Herpes viridae, option C Papillomaviridae, option D Paramyxoviridae. Correct option here is option D, that is Paramyxoviridae is the family of the virus that cause measles, or the example is this measles virus, measles or Nipah virus. This virus belongs to this Paramyxoviridae family, and Flaviviridae, it's like in the case of yellow fever, virus who cause yellow fever belongs to this family, Flaviviridae and dengue fever virus. And herpes viridae is like the herpes varicella zoster virus or the cytomegalovirus, and papillomaviridae is like in case of human papilloma virus. Question number 6. Incubation period of measles is around option A 8 days, option B 10 days, option C 12 days, option D 15 days. This measles virus is transmitted by droplets that spreads from the secretion of the nose or the throat, and it spreads 4 days before, or the infective period is 4 days before the rash appears, or 5 days after the rash appears. This is like 4 days before the rash appears till 5 days after the rash appears is the infective period of this measles, and the incubation period of measles is around 10 days. So the correct option here is option B, that is 10 days. Question number 7. Koplik spot can be seen in option A chickenpox, option B measles, option C smallpox, option D mumps. The correct option here is option B, that is measles. Koplik spot is considered to as pathognomonic of measles. Question number 8. The rash usually appears on the dash day with rise in fever, appears as faint reddish macules behind the ears, along the hairline, and on the posterior aspect of the cheeks. So macules, we have to know what are macules. Macules, they are like the flat discolored area on the skin. First, the rash will appear as macules, and the rash will appear, the option given, option A 4th day, option B 3rd day, option C 5th day, option D 7th day. The correct option here is option A, which is on 4th day. The rash will appear on the 4th day with rise in fever and will appear as a faint reddish macules that will be flat and will be discolored, in the sense it will be red area on the skin behind the ears, along the hairline, and on the posterior aspect of the cheeks. And this rash will rapidly become, this rash or this macule rapidly will become maculopapular. That is the combination of macules and papule. Papule are what we can say is like a tiny, just like a pimple, tiny or small bumps on the skin. Maculopapular. So the macules the rash will become maculopapular and will spread to the face. In this order. First it will spread to the face, then to the neck, then to the chest, then the arm, and then the trunk, and then thighs, and then will reach the legs. And in this same order, the rash also will disappear, starting from the face, neck, chest, arm, trunk, or thigh and legs. Complications of measles. Complications of measles are otitis media, bacterial bronchopneumonia, measles can also lead to this acute encephalitis complication, and which happens in 1 to 2 per 1,000 cases of measles. And measles also responsible for this very fatal condition, which is called subacute subacute sclerosing panencephalitis. Panencephalitis, also called SSPE, and this SSPE can be seen several years after measles infections, which happen in frequency of 1 per 1 lakh cases of measles. Treatment of measles is supportive treatment, which comprises of antibiotics, maintenance of hygiene, adequate fluids and calorie intake, and also vitamin A supplement. Vitamin A supplement is given to reduce morbidity and mortality of measles. A single dose of 1 lakh units is given to children below 1 year of age, and 2 lakh units is given for children above 1 year of age. These are the recommended doses of vitamin A given to children with measles.